Hey everyone, it's Bob from ProMotion Physical Therapy. Just wanted to take a moment to follow up a little bit and answer some questions that I received following my blog from last week. If you recall and you read it, last week we talked a little bit about whether or not our spines or pelvises go out of place, and that's the cause of our back pain, and whether or not it needs to be put back into place. Like I said in the write-up that I did, we used to think that this was the case, right? That people had back pain, something must have went out of place, or a vertebrae was stuck, or a pelvis becomes out of alignment, or something like that. And actually, that's the way I practiced back in my younger days as a therapist. And but as that has been researched more and more, what we found is that that just simply isn't the case. Nothing goes out of place. Nothing needs to be put back in. Our backs definitely can get sensitive and painful, and man, we can have some difficulty moving and doing the things that we want when it hurts. But it's not because anything's out of place. It's much more complex than that. It can respond with some treatment, and most people can get on and get better and get moving fairly quickly. Now, since I wrote that, I had a couple of questions sent to me. One a patient asked me, and she asked, when I get my back popped, it feels really good and I have less pain. It seems like something is back in place after it's popped. So getting your back popped or adjusted or manipulation is definitely does feel good. And manipulation is something that I do when I'm treating patients sometimes when it's appropriate. The manipulation definitely can help some individuals, can help them move better, have less pain, and get on with doing some exercise and being able to function better. But when you receive those manipulations, nothing's being put back into place. There's been some studies where they take X-rays before and after manipulation. The position doesn't change, or if there is any change, it doesn't last more than a couple minutes. So manipulations can help. It doesn't mean that things were out of place or being put back into place when you get relief from that. This one was an email I think I had. When I'm having back pain, I feel like I'm out of alignment. Okay, I look crooked when I'm standing and feel crooked when I'm walking. So there's no doubt that we can feel really kind of whacked out when our back hurts. Can have a difficult time straightening up. Can feel like we're walking crooked or shifted. Our pelvis may be off to the left. And what we think is going on with that is that that's more a response to the pain than it's the cause of the pain. Okay, so our bodies aren't dumb. They're going to try to find a position that feels better. And sometimes that better position will feel like you're a little crooked or a little shifted sideways. And usually as the pain goes away, with or without some treatment, as the pain subsides, the natural tendency will be for the body to straighten itself back out. Again, when you're feeling that way, nothing's out of place. Nothing really needs to be put back into place. Now, some treatment can definitely help in those situations when you're having that pain. But like I said, as the pain subsides, the feeling of crookedness and out of alignment stuff usually goes away and resolves on its own. Now, the big question is, why is this important? Okay, so if you're having a period of back pain or trying to recover from pain or had one many years ago and are trying to avoid it now, what we want to really reinforce is that try not to worry about your back and realize that our backs are stronger than what maybe some other health professionals or medical professionals have led you to believe or what you read on the internet. Our backs don't just pop in and out. We don't just all of a sudden get pain for no reason sometimes. It's not that unstable. It's actually a really strong structure and probably responds best to just being active and doing things without worry, moving normally, moving in a relaxed way, and not being afraid to do things. Now, when we have the mindset that that things can slip out of place, that things can lock up, that things can so easily go out of alignment, we have a tendency to baby it, to favor it, to be fearful of moving. And when we look at some of the causes of ongoing pain or repetitive pain, one of the things we find is that people that are, I would say, hypervigilant or worry or are concerned about their back and afraid of movement and aren't moving normally and freely are more likely to have ongoing problems. So if you're going through an episode of pain, and obviously I know I've had it before, it can be really painful, and it can be a struggle to move around at times. Get some good treatment, some hands-on treatment, get educated on what's going on, get some exercise. But then what we want to do is we want to build up a mindset that our backs are very strong and that they should be able to get back to being able to do everything that they want to do. If you need some help, feel free to contact me at bob@promotongb.com. Or if you have any further questions about this topic, feel free to shoot me an email as well. Thanks for listening.